Wow, this is so much fun. How's the sound? Is it good? Okay, great. Wow. Actually, getting ready for this reminded me. I've been thinking back about things, although not Girl Scouts, I admit, from many years ago. And what artists sort of asked me to do was just talk about the last 30 years in 30 minutes. So I thought, okay. So I'll skip over some of them, don't worry. But I guess the story that I wanted to start telling actually starts shortly after I graduated from college, which I was 22 and looking for those 6 months of field experience. And I left for Central America to go work in Honduras, as artists said, near the border with El Salvador, where we were setting up newly established refugee camps. At that point, there'd been a civil war going on in El Salvador for a couple of years, and refugees were leaving all sorts of places, including, actually, they were coming to the U.S., but many people from the rural areas were crossing the border into Honduras, and camps were being set up to receive them. So, yes, I went for 6 months. The person that told me to go, that I could go for 6 months, said, now don't worry, you probably won't be there that long because the Honduran government is deporting people that are going to work for the refugees. So just get down there, take a few changes of clothes. Oh, and here's this book, Where There Is No Doctor. You'll probably find it helpful. Well, that is an understatement. So was the 6 months, obviously, but I want to tell the story, my story, but it is actually also a story of Where There Is No Doctor and these materials because they've been with me now for 30 years. So one of the very first things I did, really, I think it was the second night I was staying in this refugee camp, and it was very rough still. There wasn't water, people were living in sort of under nylon, and it was very unestablished still. And I was asleep in my little cot, and it was probably 2 a.m, and somebody came to get me, and they said, you have to get up, you have to get up. I said, I've never been real good in the middle of the night anyway, but, and they said, well, you need to come because this woman's having a baby. I said, well, I do public health. But I grabbed my copy of Where There Is No Doctor, and I stumbled across the camps in the middle of the night, and was really relieved to discover that there was a young woman giving birth to her first child, attended by a group of very experienced community midwives, women who'd helped deliver many, many, many babies, which was good because I certainly had not. But they kindly let me stay and accompany them. And I had my copy of Where There Is No Doctor, and I flipped open to the pregnancy and birth chapter, and I said, okay, well, let me learn. And I followed along with them, and they explained what was going on, and the birth went great. It was really exciting to be part of. And after the next day, the women came over to me, and they said, well, you were looking at this book. Could we see it too? And I said, sure. And together we looked at the book. And it made a real impression to me to see how validated they felt by seeing their own experiences in a book. They'd never actually owned a book before, and to have a book describing the things that they knew how to do. And so we organized a little group where they would share their experiences and what they knew as midwives. We would look at the book, and they would talk to younger women that were learning how to be more experienced midwives. And of course, I knew nothing, so I was learning the whole time with them, but I was able to sort of facilitate it a little bit. And that was, I think, my first experience in terms of being a health educator. And I realized I actually didn't have to know anything. I just had to facilitate them sharing their knowledge with each other. And that was a good lesson to learn. Indeed. So I guess in the early, I'm trying to think about how to condense all of this, but there's one story that was for me a really, crucial moment. It was in the first few months that I was there in Honduras. And in addition to my job being public health, all of us had to do stints right along the border, along with the United Nations. The UN had maybe 3 people in the entire region, and so those of us that were foreigners would go with the UN people, and we would wait on the border and check to find out if refugees were coming over. And usually somebody would send word that there's going to be a group coming over. And what it is that the Honduran military was often was really not very open to having Salvadoran refugees coming into their country. So they would go along the border as well, and they would either try and keep them from crossing the river, and which was the border, or in some cases they had actually shot and killed refugees as they were coming across, or they would push them back into a military operation on the other side. So it was very tense, and it was really important that there be some sort of presence to try and receive the refugees and make sure that they actually made it across the border okay. So I was with a couple of other people, and one morning, and actually I'm going to change. This was one of the first folks that came across the border that day, and I love this photo because actually they're pretty healthy. They had only been on the run for like a couple of days, and they were in pretty good shape. And as they came across the border with a group, they said, look, there's another group about half an hour behind us. They need help. And when that group came across, they'd been on the run for like 3 or 4 weeks. And among them was a woman with a 12-month-old child. Her name was Sandra, and the baby's name was Ricardo. And when I saw Ricardo, it was just one of those moments where my heart sank. I'm like, this child is not going to make it. He was in terrible shape. He had been very, very sick the entire time that they'd been on the run. With no food, he was dehydrated. He was really near death. And his mother was traumatized. Her husband had been killed. She'd lost her other children. He was the only baby she had left. She was just really unable to care for him. So I said, okay, well, let's see what we can do. We're hours and hours and hours away from the camp where there is a doctor. But at that point, we went to a house along the border where the UN had kind of an office, and the military surrounded us with all of the refugees in the house. And we were unable to leave. So here I am with this baby who's very, very sick, a mother who's unable to care for him. She's so traumatized. The military surrounded the house. Sorry, Mom, I don't think I told you this story at the time. I think I omitted this detail. So the UN guy went out to talk to the military, and meanwhile, we were going to have to be there for at least the night. So I pulled out where there is no doctor, and I figured out, well, okay, let's just get this kid some fluids, let's try and get some food down. And, helped his mother. And we ended up being actually in this house with the military not letting us leave for about 3 days. And at the end of the 3 days, we were able to go, and we got Ricardo, who was still alive actually, to the camps where a French doctor who was volunteering was able to take care of him and help him recover. And miraculously, this baby recovered and became a very healthy and happy boy. But the part about this story that I love the fact that he was able to survive and become this wonderful child, but his mother, who at the time was just totally broken-spirited, and kept saying to me, why bother? This child is just going to die. It's fate. It's just going to happen, because we had to keep waking him up to feed him, and I would have to wake her up to help me feed him. And as Ricardo got better and she got better, she got more and more interested in health work. And she became actually one of the first community health workers that I trained in the camps, and which is something that I trained throughout the time that I was there, and I'll talk more about in a little while. But she and another group of about 20 refugees that worked with me helped organize all of the health work that I'm going to describe that I did with the refugees. And it is her story that makes me keep going whenever I'm feeling a little bit discouraged about my work, because she is really the spirit of what it is that we all work for. So I just wanted to share Sandra's story. So in the years, or months rather, that followed, this group of refugees that were being trained to become what we called community health workers or community health promoters worked with me to organize nutrition programs where we set up feeding centers for the most malnourished children, and I had the fun of bargaining for truckloads of potatoes and tomatoes and all kinds of things that I didn't even know exactly what they were, but that was really fun. We set up latrines, and I learned how to dig latrines, which I also didn't know how to do. We had some technical support for that, and we organized that. We set up, I was just over dinner talking with somebody who raised rabbits, and we set up a rabbit project. That was really great because it was one way to provide meat for the camps, even though it wasn't very much meat, it was something. We ran chicken projects. We even set up a bee project. So we did lots of different things to try and make people feel like what they were doing was making a difference, and it was. It was significantly improving the lives in the community in a way that they could feel really proud of. But in addition, we were doing things like immunization campaigns. And when a measles epidemic hit us, that can be really terrible, we were able to mobilize people throughout the refugee camp, and this was about 16,000 people, to get children who were sick to care in time and to get the proper care with a small group of doctors. There was probably 2 doctors in the camp who would come and go. And so these community health workers played this incredibly important role of connecting the community, all these refugees living and getting settled in these situations, with the doctors who sometimes didn't speak particularly good Spanish and would come and go and wouldn't necessarily know what was going on. So that was a really important part of what we were doing. So I'm going to describe some of the other health work that I did, but I guess I want to take a minute just, I think, to reflect that what inspired me, Sandra's story and the story of the other refugees, was how someone could move from being as vulnerable and as much of a victim as the people were that I was working with to becoming totally empowered and proud of the skills that they had and the ways that they were able to address a really critical need in their community, which was the health of their children, and the health of their neighbors, and the health of their family. And that kind of pride and empowerment is really powerful to be a part of and to witness. And I think that's actually one of the things that artist said I needed to explain why I stayed 16 years instead of 6 months and why I've been doing this for 30 years, and I think that is actually it. So over the years in Central America that followed, I worked in health. People would often say, well, are you a doctor? Are you a nurse? And I would say, well, no, I'm not. And doctors and nurses and other health professionals play incredibly important roles, and they're really needed. But humbly, I can say that I think I got to do something better, because what I got to do was to help people save their own lives. Doctors save lives, but what I got to do was help people save their own lives and help people make their own lives better. And that's special. That's important. So the joy that I got out of work was things like finding creative ways to train women to teach nutrition in their communities. This is a Guatemalan refugee, actually, in Honduras, on the Guatemala-Honduras border. There was a lot of refugees in Honduras in the 80s, working with her community, doing nutrition education, using something that's now pretty outdated. Anybody else know what a flannel board is? You guys remember flannel boards? Yeah. I still remember flannel boards. They're kind of cool. Something else that I did a lot of was work with doctors to train community health workers. So I love these ladies. These are some midwives that we were training. And the aprons represent sort of a baby in different stages of pregnancy. And the thing that I really, really enjoyed was working with a doctor to try and figure out how to take the information that the doctor had and make it clear and easy for women that actually couldn't read or write to understand. And also to have them share the knowledge that they already knew as community midwives, and then come up with fun and creative ways to teach it. And I actually think I had the advantage of never having been trained as a medical professional. It gave me a real advantage because the doctor would explain what he wanted to have them learn, and I didn't have any other knowledge to draw from other than what I was hearing, and could in turn interpret, well, so you mean this, right? And that's how we would do it. Anyway, that was part of what I really spent a lot of time in Central America doing. And to reassure people, I wasn't training folks with no skills. I did work with doctors who did have skills, but this was a fun one. So the concept of community health workers that I was describing earlier, or the picture of those community midwives, people from the community who are taking on a role of providing some degree of health care and also doing organizing and educating around health. That kind of model wasn't just being practiced in Central America, where I was working, but throughout Latin America and actually throughout the rest of the world. And this book, Where There Is No Doctor, which I first used and continue to use throughout my time in Central America, was one of the tools that really helped convey that information and help spread that idea and give people ideas about how to do that kind of training and how to do that kind of teaching. So just so you get a sense of a context here, this is a community midwife, this time in southern India, doing the same. She's listening to a fetus and making sure that everything is okay. That's a little fetoscope. Talk about appropriate technology. Doesn't take much, and she can hear what's going on, and there's the anxious mother listening too. Or here's someone from Tajikistan. Actually, she's also a midwife, and she's doing some education about different family planning methods. So this kind of approach actually is going on all over the world. And it's a really effective way of making healthcare happen and making people healthy. Now, where there is no doctor, it's particularly important that somebody be able to do this. But even where there is one, even where there is a doctor, the role of having a community member who can help connect people to the clinic, the role of having somebody who can help promote health inside the community, that's really important for both pragmatic reasons in terms of people's health and also people's sense of well-being and pride. And so perhaps it makes sense then that when Hesperian Foundation, the publishers of Where There Is No Doctor, approached me and my husband Todd in 1996 about two jobs that just happened to be exactly our skills match, we said, well, for this, yes, we should move. We should do this. So, and so it came to be that in 1996, with our newborn daughter, Celia, my husband Todd and I moved to Berkeley to work for Hesperian. And Todd is an editor, so that's the skill set he brings, by the way. Mine is as a health educator, and along the way I picked up a lot of other skills around arguing with the UN about budgets and raising funds and all kinds of other skills that are quite useful when running a struggling nonprofit. So we decided with a little bit of trepidation that we would do this. Trepidation because we did have a newborn. We were moving to the United States after 15 years, and Todd was going to work for me, and we didn't know how that would work either, so, but we did. And it's worked fine. So I'm going to spend just a few minutes describing what I've been doing for the past 16 years, because it is really related at Hesperian, and that is that What we do is really a continuation of the work that I was doing before, and that is helping people train community health workers and community members to do just what I was doing before around the world. Now, we've kept Where There Is No Doctor up to date, which is really important because you want good up-to-date medical information, but we've also developed these other titles. So a range of information on a range of topics: women's health, midwifery, disability, dentistry, which is a little scary to think about where there is no dentist, but incredibly important. And here's a list of those titles. And what we do is we provide information that's really accessible and easy for people to understand. You don't have to have a lot of formal education to be able to understand it and use it. So we offer practical information and ideas for creative learning activities to give people who are people like I was good tips on what you might do to make something fun. And we make sure to talk about not just the illness or the person, but the community that they live in. This is a little bit humorous, but you get the drift. Because it is important to look not just at the individual, but at the community and environmental factors that are making them sick. And that's as much of the importance of healthcare as actually providing any kind of curative treatment. That was interesting. Okay. So Hesperian pioneered an open copyright policy. Nowadays, people talk about open source more frequently. Back 35 years ago, when Where There Is No Doctor was first done, Hesperian pioneered an open copyright policy that basically says, as long as you're doing it not for profit, take this, adapt it, make it your own. And through that policy, that Where There Is No Doctor and our other books are in over 80 languages and used in more than 106 countries. This is a list of some of those. One of the fun things is that when people do adapt those books, they take the illustrations and they adapt them to their own setting. So here's an example of the same image that's been adapted by 3 different groups. Now, the last piece I wanted to just describe is some work that we've been doing quite recently. About 3.5 years ago, we got a grant from the Bill and Melinda Gates Foundation, which, if you do health work, is like a big deal. And what they gave us a grant for was to say, okay, you guys have been working in print all these years. Experiment with, and this was something that we wanted to do, experiment with how you can take advantage of new technologies and deliver the same information across other formats. So we've spent the last 3 years learning and experimenting, and I've certainly been learning a lot because I didn't have a cell phone. I barely do internet other than email. I'm definitely not a techie, so this was a real learning curve for me, and we had the help of many volunteers who worked with us to do this. But what we've been doing is expanding from book to computer to mobile phone. So one of the things that we did was we tested some of the ways that we were providing health information over computers, just like we test the health content that we develop for books. And we did this with groups around